This is
Make It Plain.
MIP
With Masamela Matfumo.
Mark Thompson.
Make it plain.
Get woke.
Folks, it's time for open enrollment, and here to tell us all about it is the administrator for Centers for Medicare and Medicaid Services. We're happy to have with us, and also a fellow Georgetown Hoya. That's the most important thing.
Of course.
Chiquita Brooks LaSure. Madam Administrator, how are you today?
I am wonderful. Thank you so much for having me. How are you?
I'm just fine, and thank you for joining us. And obviously, this is a very important and timely discussion. Let's start with some of the basics. Open enrollment has begun, correct?
Yes.
What do people need to know to get started, to get going? Where do they go? And what's different? Things are a little bit different this time. Things may even be a little bit better, a little bit easier too, right?
That's right. This is such an exciting open enrollment period. So the first thing that people should know is if you do not have health insurance or feel like you don't have affordable health care insurance, go to healthcare.gov and see if you qualify for an insurance plan offered through the federal marketplace. And thanks to the Biden-Harris administration, the American Rescue Plan has made coverage more affordable than ever. 4 out of 5 people that come to healthcare.gov are finding that they can find a premium for $10 or less per month. And that means that you would have access to going to the doctor, to getting your prescription drugs, getting healthcare, if you pay a premium that could be as little as $10 per month.
Mm-hmm. That's very important. How has the pandemic affected enrollment, if at all?
Thank you for the question. So we have seen how important it is during this pandemic that people have access to health coverage for all of us. And during this year, we have seen record enrollment in healthcare.gov coverage, in Medicaid coverage, in CHIP coverage. And so people are enrolling, and we've tried to really make sure that everyone knows that they should be able to find coverage options that will work for them. So we strongly encourage people to enroll and to take a look at healthcare.gov. And if you're eligible for Medicare, come look at medicare.gov.
Mm-hmm. I would guess too, with a lot of people's employment situations being in flux, I should say, this is critical because some of us who have gotten traditionally our healthcare from employment, if that's up and down or whatever, there's no better time than the present to get on there and take a look.
Absolutely. I was talking to a friend at a wedding a couple of weeks ago. They have always gotten coverage to their employer, and they moved to Texas and were asking me, they've never bought coverage themselves before. And I was talking to them, and they're now working on their own. They're now living near their families. And I said, go look at healthcare.gov. So many people who may have found themselves moving or starting their own business or changing jobs or losing jobs should look at healthcare.gov.
More MIP after this message.
Geico asks, how would you love a chance to save money on your insurance? Of course you would. After all, who wouldn't love a great deal, right? And when it comes to great rates on insurance for all of the things in your life, Geico can help. Like with insurance for your car, truck, motorcycle, boat, and RV. Even help with homeowners, condo, or renters coverage. You could save even more with a special discount when you bundle your coverages. Plus, add the easy-to-use Geico mobile app, available 24-hour roadside assistance, and more. And choosing to switch to Geico becomes an easy choice. Switch to today and see all the ways you could save with great rates and discounts. It's easy. Simply go to geico.com to get a rate quote or contact your local agent and get started seeing how much you could save.
We're very proud of the fact that you are the first African-American in this position as administrator. How important, how helpful has Affordable Care Act, open enrollment, access to these things, how important has it been for the African-American community?
This is so critical. I would say that making sure that we have health insurance is necessary, not sufficient, but necessary for addressing health inequities in our country. And we are seeing them across the board, whether we look at maternal health outcomes, whether we look at behavioral health and access to care. It is vital that people in our community get health coverage and get to the doctor early. I was sharing with a friend this morning about how my mother years ago, because she went to the doctor early, was diagnosed with cancer, and they caught it so early that she, many years later, is fine. But you want to get to the doctor before things are serious. So just so critical for us.
It is critical. I also checked out some of your tweets lately before we chatted. You've been tweeting a lot also in this regard about maternal health overall, haven't you? That's
yes.
Something that is not given the attention. I mean, we still have a lot of ways to come up on that, don't we?
We do. And it is true regardless of income. A woman like me, right, educated with health insurance, has worse health outcomes than my white counterparts. And it is critical that we make sure that all women who are pregnant, even before you have a baby, right? It's a lot of it is about the health that you have going into a pregnancy, that we make sure that the follow-up care is that you get it. Some of the deaths and problems that women face is a couple of months after the baby's born. And I'm a mom. I know, it's hard to juggle. There's a lot to do when you are a mother, and getting to the doctor yourself can feel like the least priority of all the things you need to do. But it is vital for our community that we make sure that women have access to the health care they need. And that starts with getting health coverage.
More MIP after this message.
Hey peeps, it's your girl, Danielle Moody, host of Woke AF Daily. Every weekday, I'm sounding the alarm and keeping you woke to all the pure evil that is going on in our country. Check me out now at patreon.com/wokeaf. Get 5 new shows every week for just $5 a month. Get woke and stay woke as fuck.
Lastly, we know we're still dealing with Build Back Better. There some aspects of that legislation that would affect Medicare, Medicaid, and the ACA itself that would
Yes.
lend some improvements. Can you talk about that?
Yes, the president has agreed with Congress to make some major health expansions. So the expanded subsidies, the financial assistance that we're talking about, that is going to be extended for several years. Even more critical is the coverage gap. So people in states who have not expanded Medicaid will now have access to care starting next year, which when Congress passes the legislation. The CHIP program, which covers children of modest backgrounds, that program is authorized permanently. So children will know that they have access to care, and many, many other provisions are on the way once Congress passes the legislation.
Yeah, absolutely. So folks, healthcare.gov, the place to go to, and otherwise go to Medicare.gov as well, correct? Those.
Mm-hmm. That's right.
And just real quick, we did touch on the premiums and whatnot, and some of the improvements in the open enrollment aspect. any new things on the Medicare side that people should know about and should be incentivized by?
I would say that a couple of things. In Medicare, there are many programs that are designed to help Medicare coverage be more affordable, called Medicare savings programs. So check those out if you're not if you're not aware, if you need help paying your premiums, your co-pays, there is more assistance available. And Medicare.gov, you can also check for a health plan if that's the kind of coverage you want and compare options. You can stay enrolled in traditional Medicare. We just welcome people to take a look, and feel free to call if you want to talk to a person and get help. The numbers are on the website. For Medicare, it's 1-800-MEDICARE.
Wonderful. Healthcare.gov, folks. Medicare.gov, the first African-American administrator of the CMS, the Centers for Medicaid and Medicare Services. We thank you for joining us, and keep us posted. Let's talk again soon, okay?
Good luck, too. Thank you. Have a good rest of your day.
You too, and Hoya Saxon. Thanks for getting woke and listening to Make It Plain. Please remember to listen, like, and wherever you get your podcasts, please give the show a 5-star rating. And please do spread the word. Let's all continue to pray for each other during this pandemic and this police-demic. If all hearts and minds are clear, it has been made plain.